Hi, I wanted to do a video on hay fever because between the months of March and September, the symptoms of hay fever can be more common, and this is because pollen count is quite high, the weather is quite warm and humid, and sometimes quite windy as well. And the symptoms of hay fever can include coughing and sneezing, a runny and blocked nose, itchy, red and watery eyes, an itchy throat, mouth, nose and ears. You can lose your sense of smell. Some people describe a pain on the sides of their head and also on their forehead. And you can get a headache and feel very, very tired. Some people do describe it similar to being like a cold, but a cold would last 1 to 2 weeks, whereas hay fever symptoms can last longer. And there are other parts of a cold in terms of symptoms that would differentiate the two. And there are a number of things that you can do to help your hay fever symptoms. And these include putting a bit of Vaseline on your nostrils, and that will help trap the pollen, stop it from going up into your nose and causing the symptoms and reaction. You can wear wraparound sunglasses, a mask, or a wide-brimmed hat to prevent pollen getting into your eyes and nose. After you've been outside, getting changed and showering to get rid of the pollen. Keeping the doors and windows of your house closed as much as possible. Vacuuming regularly and dusting with a damp cloth. And some people use a pollen filter in their car, or they have a HEPA filter in their vacuum cleaner. They do say do not cut grass or walk on grass if you have severe hay fever symptoms. To try not to spend too much time outside. Not to keep fresh flowers in the house, especially if that's what triggers your hay fever. To not smoke or be around smoke because they can make your symptoms worse. And not to dry clothes outside because they can catch pollen. And they do say not to let pets inside, which is quite difficult because they do carry pollen from outside. If you are unable to adhere to some of the do's and don'ts that the NHS website have put on about hay fever and managing your symptoms, then you can trial medication. So antihistamines are what we use in general practice, and also they are available over the counter in the pharmacy. And these don't just come as tablets, they can come as nasal drops and sprays as well. And some people, their symptoms are so bad that they have to use steroid nasal sprays, but these are the only things that can sort of control their symptoms. And it's really important to see a GP if your symptoms are not improving or they're just getting worse. The other thing that we discussed on the radio was the fact that hay fever can happen at any age. You can be older and suddenly develop hay fever, and it can affect people in different ways. It doesn't just affect the nose. Maybe you just have eye symptoms, for example, or maybe you just cough or sneeze more often. But it's really important to see the GP if you're having symptoms that are unexplained and you're not sure if it is hay fever or not. Thank you for listening to the video and hope you have a wonderful day.